Thank you very much. Good morning to listener. Uh, from South African Medical Association, we have been last 30 years have been informing Department of Health, provincial and national, that because of poor infrastructure, poor health planning, poor implementation, the health system is not up to the mark. And of on the top of that, we had the disease burden like HIV/AIDS, tuberculosis, and now with COVID-19 is just inundated. And because of this number of COVID-19 just increasing, second wave like a stiff numbers of cases reported all over the country. And the first wave we had started first February or March, and we had only one case, and it became like a millions and million cases now. Thousands and thousands of people died in public sector. Shortage of staff, shortage of health workers, shortage of oxygen, shortage of bed. You can see Steve Biko, what is happening. You can see Wentworth Hospital yesterday. Patients are crying on the floor. And it was promised that we will build a field hospital, mobile hospital, enough isolation ward, quarantine ward, but we don't see practically where are those functioning. Is it functioning? Or those quarantine area is got enough infrastructure inside? Is there oxygen available? Is the backup services are there? One of the private hospital, 6 patients died because of oxygen pressure was not there. They didn't have plan. So situation is very serious. We need to do more. We are working hard as a health workers are getting sick. There are no backup. There is an announcement that the minister appointed 4,000 health worker doctors. That is not the truth. That was those 4,000 is interns and community service, which are for the training purpose. When they qualify from medical school, they go and get the training in a hospital under supervision. So they cannot work independently and deal all these challenges. So still they need to fill all those vacant posts, especially there's a medical officer, junior staff, vacancies are not filled up. There are a lot of medical doctors looking for a medical officer post.
Of course. And, part of the concern here is that we've kind of known from the start of the outbreak that the second wave is more likely to be more intense than the first. Have you been able to ascertain why it feels like we're so gravely unprepared for this bout of infections?
You see what happened? When we started the first wave and went to the lockdown stage 1, people got relaxed. The health system maybe got very relaxed. They didn't continue keep the pressure to maintain the preparation. And second wave came with a different strain and especially mutation of the virus. And it started in Eastern Cape. And from Eastern Cape gone to the Western Cape. From Western Cape to it came to Durban, KZN, and KZN is the highest number cases at the moment. So that's why we supposed to be ready to deal the second wave. We knew there will be a second wave coming in September, October. The scientist, the epidemiologist has been warning us, but it came on December. And basic SOP was not followed and not implemented properly. Like, for example, putting a mask, social distance, hand washing. If you walk around the city center or any shopping center, you will find people who are not wearing masks. Sanitizer was a poor quality. In fact, government should have given masks to the people free so people can use. They were making money by selling masks. People couldn't afford to buy masks, and you've been using masks every day. So, and the awareness campaign was not enough there.
What is interesting is that MECs across all provinces, at least as far as I'm concerned, have at every opportunity defended the situation where they govern, saying, in fact, we haven't necessarily reached crisis point, although we're fast approaching there. Do you get a sense that there is an undue sense of denialism currently taking place? And by that I mean a flat-out refusal to reckon with what people on the ground are actually experiencing, especially in the wake of this really troubling video we've seen making the rounds at Wentworth Hospital. I'm not sure if you've seen some of that footage, where patients literally in distress on the floor, asking for help and no assistance inside.
Exactly. I have seen the video last night, and I see Department of Health wanted to investigate the matter. We're not saying that ministers are saying this and that. They must have an independent inquiry from patient. Patients are telling us they're running around hospital to hospital, private hospital to another private hospital, another private hospital, public sector to another public sector, and they are not getting bed. There are not enough oxygen. You see, ministers say, yes, they got empty bed, 67% bed is occupied, 40% beds are empty. Yes, there are empty bed in the hospital. Those are not covered ward. ICU is full. ICU and high care and where the high pressure oxygen needed, those areas are full. So we are talking those space. If you got a space in a pediatric ward, we cannot put a covered patient in a pediatric ward where you say small children need to be treated, not adult patient. So there should have been created more high care bed, because any given time, nobody can say my ICU is not full, my mortuary is full, mortuaries are overcrowded, and public sector is overcrowded. You can see Steve Biko from Pretoria, patients are running to the Mafeking to get a bed. Kimberley to Bloemfontein, they have to transfer patient. So these are the patient's report. And we not saying that we just saying for the sake of that the health department is poorly managed. No, you must ask the patient on the ground. And we hear from Wentworth what the patient saying, take me out from here. I cannot breathe. So if you go to the private hospital, if you don't have a money, you cannot get oxygen. The moment you enter in a private hospital, you have to pay 40, 50,000 deposit. If you have a cash, if you have got a medical aid, they will phone the medical aid and check whether this valid or not. It's got a amount to be treated. So if you don't have a medical aid, you cannot go to the private hospital. And private hospital is treating 10 to 15% of the population who have the medical aid or can afford the cash. Private hospitals are not also well equipped because they are full. Yeah. They don't have enough staff. Nobody is doing moonlighting anymore in private hospital because the government hospital, same health worker, nurses used to do the moonlighting in a private hospital. They are becoming sick. The disease, we have seen some private hospital patient corona positive. They got contacted from there. They went to do the moonlighting in a public hospital. They brought the infection in a public hospital. So private hospital or public hospital, what we are saying, there are not enough ICU bed, there are not enough ventilator, there are no high care. Because the requirement of oxygen is so high, the oxygen pressure is low. That's why I'm saying one of the private hospital sick patient died because they didn't have backup for oxygen checkup.
Sure. It really is a concerning situation. And, as the back and forth continues, what is emerging now is many patients really corroborating their experiences.